As Bob mentioned, I want to talk about worker populations in these non-traditional settings. And I'm going to talk specifically about those in the indoor environments, those workers who are in facilities. And in these non-traditional worker populations, there are exposure risks that exist, but employers do not provide and workers do not wear respiratory protection. And then there are other environments where, yes, there is acknowledged exposure risks, but and workers are provided with respirators, but typically there's no respiratory protection program whatsoever. And I want to remind everybody that in a work-related situation, when employers require workers to wear respiratory protection, there must be an OSHA-compliant respiratory protection program in place. And so it's a violation just to hand out respirators to workers in these situations. So some of these non-traditional worker populations are found in industries that we typically don't think about as being having a lot of inhalation risks, bars and restaurants, hotels, retail stores, a conventional office environment, correctional facilities, grocery stores, schools, meatpacking plants. But yet, if you step back and look, for example, there are exposure risks in these industries among workers. For example, cleaning and maintenance workers, appear in all of these industries. Where workers may be exposed to asbestos, lead, solvents, infectious diseases where respiratory protection is necessary. What I'd like to do with my remaining time is pick two of these industries that aren't conventionally seen as having the need for respiratory protection. Schools, K through 12, and meatpacking facilities. And I want to talk mostly about before the pandemic, but I also want to mention a little bit about the influence of the pandemic on these populations. So let's start with schools, K through 12. Schools are really complex environments. It's more than just teachers and students. There's a whole host of occupations within a school that we need to examine. Custodians, food service workers, special educators who take care of students with disabilities, maintenance personnel, school nurses, administrative staff, and a whole host of other occupations within a school. Before the pandemic, this is sort of the traditional, typical situation in a K through 12 school setting. Most workers are not required to wear respirators. However, there are some, but not many, who do wear respiratory protection. For example, vocational teachers. There's some that who in some of their shop activities like carpentry and masonry will be wearing respiratory protection. There's some, but not many, school nurses and health aides who will be wearing respirators in schools around the country, particularly during the influenza season, maybe when there's a tuberculosis, measles, or pertussis outbreak. There are some, but not many, custodians and maintenance workers within schools who will be wearing respirators for solvent exposure, removing graffiti, asbestos-related exposures. But it's typical that in those situations, and they're not common, but in those situations where school employees are wearing respiratory protection, there's no fit testing, there's no medical evaluation, there's no teaching, and there's no respiratory protection program. So clearly, we have, I think, a very serious situation where workers are provided with respirators, but it's not clear, like Rich Metzler said, that you really can't assure that respirator is protecting those workers unless you have a comprehensive respiratory protection program. So now we're flipping to the pandemic situation briefly, and that's sort of a hot topic now with schools about to reopen. we have a COVID-19 outbreak. The CDC guidelines recognize their perspective is that it's mostly by droplet transmission, and that cloth face coverings are recommended for teachers and students. Now, we know that cloth face coverings, they're not respirators, they're not even personal protective equipment. They're really only a source control. But there's now a substantial body of scientific evidence that actually this virus can be and is transmitted by airborne means. And with that evidence, we really are start moving into the necessity for providing respiratory protection. And that means looking at, or ought to mean, looking at those employees within the school system who need respirators. Who might do that? What's the risk assessment? Would it be nurses who take care of sick children and students? Would it be special educators who have very close contact on a daily basis with their kids? Are there others? These are questions that haven't really been adequately addressed in the whole school opening process. The second example is meat packing. Before the pandemic, there's really no respirators being used, at least among workers who are working on the lines processing meat. There's no program. There's really no guidance. Workers work very close to each other, 2.5, 3 feet next to each other, side to side, 4 feet or so across from each other on these conveyor belts. So there's not been a big need for respiratory protection in those populations. But now that you move into the pandemic situation, it's a different story. Meatpacking plants, as I think everybody knows, are hotspots for outbreaks. As of July 27th, in this country alone, there are more than 37,000 workers in meatpacking that have been infected, at least 168 COVID-related worker deaths. Again, CDC guidance is for cloth face coverings. It's droplet transmission. However, the body of evidence that I talked about earlier about airborne transmission has just been, a couple of weeks ago, was enhanced by a German study of the largest meatpacking facility in Germany, where they believe that that publication confirms that there's airborne transmission going on in those meatpacking facilities, and that once you over large distances, actually up to 26 feet from the index case. So, and those workers at that facility were wearing simple one-layer face masks. So we have this issue really in meatpacking. What are we going to do to protect workers? And there's a whole host of other approaches besides respiratory protection. But respiratory protection is something that really ought to be examined. So, Bob, that's it for my presentation. Thank you.